Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
And good afternoon. Welcome to Life Unrehearsed. I'm Matt specializing in life transitions, home care, and the senior living industry.
And I'm Corrie, a clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on today's show, we discuss the changing landscape of medical assistance in dying.
And before we do that, I want to talk about an interview that you did, Matt, with a very big-time U.S. broadcaster.
You know what? This was something, it was really special. I was very fortunate. I was invited to a podcaster called Wes Moss. He's a big guy in the U.S., 400,000 followers. And it was to talk about senior living trends and transitions, what I do in my day-to-day life. And it was quite the experience just to be involved in one of these big-time podcasters, you know, with the pre and the post promos and the social media. So it was quite the experience, and I was able to share some of my knowledge and expertise. So I was quite proud of that.
Hold on. When we say big time, how many people were talking?
Yeah, over 400,000. So it was
Whoa!
It was a nice number. Yeah.
Well deserved, Matt.
Thanks. Now, what do we have coming up on the second half, actually, Corrie?
Well, speaking of caregiving and the work you do, why it might be time to move when care becomes too much at home, and how to deal with the guilt when making those kinds of difficult decisions about life transitions.
Yeah, looking forward to that. It's going to be coming up after 3:30 in the second half of the show. All right. Now, you know, as our population ages, conversations about later stages of life become more common. The topic of medical assistance in dying, we've heard of that. It's known as MAID, is becoming more common. In fact, more people are choosing medical assistance in dying than ever before. Yet there's an increasing sentiment that conditions need to be even more relaxed to allow for more situations where MAID can be implemented. We wanted to get the perspective of an expert, a doctor that actually performs these medical procedures, and we have Dr. Stefanie Green on the line. Dr. Green recently published a book called This is Assisted Dying. Dr. Green spent 10 years in general practice and another 12 years working exclusively in maternity, of all things, and she was dealing with newborn care before changing her focus in 2016 to medical assistance in dying. Dr. Green is the co-founder and current president of the Canadian Association of MAID Assessors and Providers, known as CAMAP. She's a medical advisor to the BC Ministry of Health MAID Oversight Committee. She's a clinical faculty at the University of British Columbia and the University of Victoria. Dr. Green, welcome to Life Unrehearsed.
Thanks for having me.
Well, thank you very much for taking time on a Saturday. You're on the West Coast, I believe, in Victoria, aren't you?
Yeah, it's just lunchtime where I am.
All right, bon appetit. Well, you know, for our listeners, maybe let's back it up a little bit. And if you could just exactly what is MAID, medical assistance in dying?
Sure. You know, I think there's a lot of different terminology used out there, and it can be kind of confusing. So I'm going to give you the formal answer. Let me be really clear. Medical assistance in dying, or MAID, is the legalized, compassionate end-of-life care provided by healthcare practitioners who prescribe and administer lethal medications at the explicit request of a competent adult with the goal of relieving pain and suffering. That's what we're talking about.
You know, it's probably the most comprehensive and clear definition I've ever heard. And I'm in the mental health field, so I really appreciate that. Let's be really clear. What conditions need to be in place to qualify for MAID?
Great. Thanks for asking. I want to emphasize to you and your listeners both, you can't just call up and ask for this and get it. There's a rigorous system in place, and it has a lot of different moving parts. So there's a number of eligibility criteria as well as what we call procedural safeguards. So let me just break it down a little bit so I can be super clear. If you want an assisted death in Canada, you do need to ask for one, and you need to be the one to ask for it. So nobody can ask for this care on your behalf. And there's, like I said, there's a number of eligibility criteria that must all be true. So here they are. You need to be 18 years of age or older. you need to be eligible for what we call government-funded health care. So you need to be eligible for Canadian health care. You can't come to this country as a tourist and pay up front privately. That just doesn't work. You have to be eligible for Canadian health care. You have to make what's called a voluntary request for this care. So no sense of being coerced into this decision, right? Part of my job is to make sure the patient themselves is asking and that it's really what they want and consistent with who they are. They need to make what's called a capable decision. So the patient needs to be capable. They need to understand what's wrong with themselves. They need to understand what the treatment options are, including palliative care and the risks and benefits of those treatment options. They need to understand and appreciate the ramifications of their decision on themselves, but also on their loved ones, and then give informed consent to receive this care. And they need to have what's called a grievous and irremediable condition. And that's actually defined in the criminal code of this country. And a grievous and irremediable condition is someone who has a condition that's serious. It's a serious illness, disease, or disability that puts someone in what we call an advanced state of decline in function, really, and that they need to be suffering in a way that they deem intolerable to them and that can't be relieved by any means acceptable to them. So all of that needs to be true for you to meet all the eligibility criteria. And on top of that, you need to meet what we call procedural safeguards. And that has more to do with process, right? So in fact, there's two pathways to access MAID to do with different processes. Track one is a little bit more straightforward. If your death is what we call reasonably foreseeable, if you're on a pathway or a trajectory towards a natural death, then safeguards are things like you need to make a written request. It has to be witnessed by someone. You know, you need to see two independent clinicians to see if you're eligible. So kind of straightforward procedural safeguards. If your death is not reasonably foreseeable, if you're not on an obvious trajectory towards death, you can still access MAID, but you have all of those safeguards plus some extra ones, which makes sense because you're not, directly heading towards your death. So that's kind of the overview. There's eligibility criteria and process procedural safeguards. Rigorous.
Listening to Life Unrehearsed with Matt and Corrie, and we're talking about medical assistance in dying with Dr. Stefanie Green, the author of This is Assisted Dying. You just got a very thorough explanation of the conditions. And Dr. Green, these conditions are even going to be expanded as we head into March 2023 for people with mental illness, from what I understand. Can you explain and elaborate?
Yeah, so to be clear, I think there's a lot of confusion about this. When our law originally changed, there was no exclusion for people with mental health disorders. So they were allowed to try to apply if they felt that they met the criteria, if they wanted to ask for this. But one of the original criteria was that your death needs to be reasonably foreseeable. And for most patients with mental health disorders, that simply wasn't a criteria that they could meet. So they weren't really ever or very often eligible for care. That criteria was removed. And so in 2021, when the Canadian federal law about MAID, about assisted dying, was amended, it put in a specific exclusion. So people who have a mental health disorder as the sole underlying condition for their application, they don't have anything else wrong with them, they're not allowed to access MAID at this point. Until March of 2023. So the government gave themselves 2 years to try to work out how to approach this patient population. Do we need extra safeguards? Are they especially vulnerable or not? They knew, the Senate held them to the test, that they couldn't exclude this patient population based on their diagnosis, but we kind of sensed that might need some more guidance on how to approach them. So they've given themselves 2 years. And in March of 2023, if mental health is your only underlying condition, you will have the potential access to MAID.
This is all very interesting, and I hope people are listening because it is a confusing but such an important potential strategy. I don't even know, a procedure for someone who may be eligible. And I certainly think that we have to understand that it is not just here it's easy. You make, as you said, you don't just make the request. Yeah. So we have to go out to traffic. But when we come back, I would like to hear more specifically. You've done it. What the actual Dr. Green is going to describe what the procedure of getting MAID or being involved in MAID looks like.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Welcome back to Life Unrehearsed. I'm Corrie Sirota, along with my co-host, Matt Del Vecchio, and we are discussing medical assistance in dying, otherwise known as MAID, M-A-I-D, with Dr. Stefanie Green, who's the author of This is Assisted Dying. And Dr. Green has performed this procedure, so I thought it would be interesting to hear, if you wouldn't mind, sharing a little bit about a description of what medical assistance in dying, the event itself, looks like.
Yeah, so thanks. So after going through an assessment, through that rigorous assessment, on the day of, most typically this is in someone's home where I work. It can be in other settings, but typically I would show up at someone's home, introduce myself to people I don't know, and I would immediately take a couple minutes privately with the person involved. And I describe some of this in my book. I'll use the example of Harvey, one of my first stories. I went into Harvey's home. I took some time with Harvey to speak to him before the event to make sure he still wanted to go ahead. He hadn't changed his mind. We have a very, very honest and open conversation at that time, very private, which I really value. And then if Harvey wants to go ahead, which he did, I work with an IV nurse who will set up an IV in his arm while I'm talking to his gathered guests. And Harvey had about 8 or 9 people that he had invited to this event. We spoke in the living room. We had a conversation about exactly what would happen next, the order of events, who would be in the room, where they would stand. And I go through the medications with them to describe exactly what they might see, to be as transparent as possible, answer all questions. Once that's done and everyone seems prepared, we go into the room together, we gather around. And in Harvey's case, it was just his children and his wife and myself. And we all gathered in quite closely around his bed. Each family member wanted to be touching Harvey, holding him in some way. His wife was very close by in a chair pulled up. They were head to head, forehead to forehead, whispering to each other, saying their private goodbyes. It's a very intense and emotional time, very private and very, sometimes the mood is sad. Sometimes the mood is grateful. It can be a variety of ways, but it's always intense and fairly extraordinary, to be honest. They exchange last words. We accommodate any sort of rituals. People want readings or prayer or music or toasts. We do all that, and I administer medications. And quite frankly, the patient falls asleep with the first medication into a very light and comfortable, peaceful sleep. And I go through my medications, and after, on average, 8 to 10 minutes, the heart stops. So a very quick and peaceful event, which often leaves family a little bit stunned. Patients are very, very at peace when that day comes, but I find families are a little bit more grieving and often need some help and some debriefing afterwards. So, that's the bare bones of what really happened.
Essentially, that's where I come in as the grief counselor,
right.
but
Exactly.
I do think it's extraordinary what you're describing.
It really is. And Corrie, yes, I'm sure as a grief and bereavement specialist, this resonates with you as well. And Dr. Green, it's very interesting. I'm with seniors all the time, and I hear the adult children, and I think a lot of people are pro MAID. However, as I'm listening to you, I'm sure as family members that are listening as well, I'm sure it does get quite emotional for the family. This might be something that someone wants, but you're in there. What are some of the reactions of some of the family members there? You must have a full array from happiness to sadness, and maybe a combination of everything.
Yeah, it's true. I've been doing this for 6 years. I've seen a wide range of reactions. I do think that people, despite anticipating this, planning for this, knowing this is coming, it's still a bit surreal when it happens. There's often a bit of kind of just stunned silence at some point, when people are grieving at the moment. So a lot of a mixed emotion, like sadness for sure, but, you can't help but notice that there's a fair bit of relief. Don't forget, these patients are suffering intolerably, and their family members know that. So there's this confusing mix of emotions in family members: sadness at their loss, relief at the end of suffering in their loved one. But I'll tell you what is almost universally consistent. Almost universally, I'm immediately always, I hear expressed by the family a lot of gratitude for the possibility of this care, gratitude for the actual care itself, to see the end of suffering of their loved one is difficult for them, but they are grateful for it. And I was a little overwhelmed by that when I first started doing this work. It's pretty consistent.
That's the voice of Dr. Stefanie Green. She's the author of This is Assisted Dying. We're talking about medical assistance in dying, or otherwise known as MAID, MAID. You got to know this question is coming, Dr. Green. I already told you what I do, and you've talked so and described so beautifully and eloquently about the process and the criteria, etc. But you, Dr. Green, this has got to affect you. 6 years. How does it affect you personally, given that you're the one responsible for administering the medication to hasten a person's death?
Yeah, it is a really large responsibility. I do thank myself, my colleagues across the country that do this work. We feel the weight of that responsibility. Nobody does this lightly. There has been a tremendous growth in the width of my shoulders, I would say. But and my colleagues told me to beware when I first started, to be careful, my colleagues in Europe who'd done this. And I do take time to self-care and reflect on what I'm doing. But I have to tell you that there's, I feel when I leave someone like Harvey, when I leave their house having done this, I feel like what I've done mostly is that I facilitate a person's final wishes. They've come to me asking for this. I've helped facilitate that event for them. I don't feel badly about that. I feel like I've done them a service, that I've done good work, and I feel like I can continue to do this work. I feel like it's good work. And the two most common emotions I'm exposed to by doing this work are relief, that patients feel relieved that they can have this conversation and possibly this possibility with me, and gratitude from the families and from the patients. So that sustains me. I find this work profoundly meaningful, and that really sustains me.
Dr. Stefanie Green, the author of This is Assisted Dying. Dr. Green, we have to wrap up pretty quickly, but one more quick question, because this is a polarizing topic. There are some pro-MAID and there are some anti-MAID as well. And there's even a common misconception that it should not be the role of the clinician or the physician to perform medical assistance in dying. What are your thoughts on that?
Well, very briefly, I think that the role of a physician is to offer help to their patients. I mean, as a family doctor, people came to me at some of the most intense and crazy moments of their lives, right? So I've seen people through all the roller coasters of life, and I think from birth to death, it is the role of the clinician. We treat sometimes, we care often, and we comfort always. That is the role of a clinician. I do not see, journeying with someone through end of life. I don't see that as any different as our role throughout the entire lifespan of our patients. That is what we do. That is why we went into medicine. I feel privileged to be in that role, and I think that is the role of a clinician.
Oh, very well said, and good on you. I think when you said there's a sense of gratitude, absolutely. I'm sure there are many, many families, as emotional as it is, that you're doing a service that I think is very well received by many, many families. Dr. Green, we want to thank you very much for joining us here on Life Unrehearsed, and we'd love to ask you, how can the listeners get a hold of your book?
Yeah, the book's now available in print, digital format, or audiobook. All at your favorite local bookstores are all carrying in stock, all available online, and more details available at stephaniegreen.com.
Well, wonderful. Thank you very much, Dr. Green.
Thanks for your time.
Thank you.
All right. Dr. Stefanie Green, the author of This is Assisted Dying. Corrie, what do we have coming up on the second half?
Coming up on Life Unrehearsed, why may it be time to move when care becomes too much at home, but equally important, how to deal with the guilt when making difficult decisions about life transitions. That's coming up next on the second half of Life Unrehearsed.